So, good evening, friends, and welcome to another amazing episode of Crossing Boundaries. I know it is indeed a pleasure to meet you every month. This month we got delayed. Generally, we have this session during the mid of the month. This month it got delayed because we were shifting. And I'm super excited to share that we have shifted our practice to a bigger, better place with lots of facilities for all of you. So do join us, and our appointments are open from Jan 3rd, 2022. Right? So let this new year bring in lots of good health and best wishes to each one of us. And with no further ado, today I'll go ahead with today's topic called tooth jewelry. Many a times I have been asked by patients like, what is tooth jewelry and is it necessary and what does it do and things like that. So today it's a more of a question and answer kind of a session where I will answer a lot of questions generally put forth by my patients and also give you some idea of the procedure of tooth jewelry. And why this topic today, right? So generally, whenever I choose a topic to, present to you all weekly, monthly once on crossing boundaries, I always think, what is the topic I can share? And of late, people have been very, conscious about the way they look and the way they present themselves. And tooth jewelry or this kind of, adding crystals to their teeth has become the talk of the town, and everybody is asking about that. So it is now no more of just that few people get it done. Now almost everybody wants to get this tooth jewelry on their tooth. So then the question is like, is it safe and can I get it? How long will it take and all that? So I'm sure today at the end of the session, you will have a lot of your questions answered. And with no further ado, I'm going to start sharing my screens. Just give me a second. So I'm sure you're all able to see the screen right now. And today we are at Crossing Boundaries session 7. And today's topic is going to be on tooth jewels or tooth jewelry. So you can see that sparkle on that person's teeth. Generally, that tooth is called the lateral incisor. So we place this crystal on the last or the back portion or the distal portion of the lateral incisor, or we place it on the mesial portion of the canine. So generally, this crystal is placed on the corner of the mouth. So we see the smile line. And when the patient smiles, it is very necessary that, they are able to see the sparkle. And it, adds a kind of a glitz and glamour to that smile. So it's very important for us to look good and feel good, right? So that is how the tooth jewelry came into being. So if you ask me what is tooth jewelry, as I told you before, tooth jewelry is the latest fashion craze which has hit India. And the tooth jewelry has very classic designs, which is, an elegant complement to your standard jewelry, which you wear. Generally, as a woman, you would wear your neck piece or your earrings on the, close to the head and neck region. Along with that, the tooth jewelry also. And today, men are not left behind. They also wear jewelry. So this adds for both the genders. And when placed on the tooth, this jewelry, especially with the mouth saliva, you will see it like, a starting kind of an expression. When the person smiles, you will see them really being very expressive. And it's a distinctive way of identifying one's individuality. So there are two main types of this tooth jewelry which are available. One is called the twinkles and the other is called the dental gems. The twinkles are, a collection of gold, which is a 24-karat gold and white gold jewelry. So how they make jewelry externally, that is a similar way they make tooth jewelry. And this jewelry is available in different shapes and sizes, and it could be added with precious stones also, like diamonds, sapphires, and rubies. And dental gems are basically in different colors, and you have them in diamond, which is generally white. You have rainbow, which is multicolored. You have ruby, which is red, sapphire, which is blue, emerald, which is green, emerald green, which is deeper green, aquamarine, which is almost whitish blue, pink, and sapphire light, which is light kind of blue. So you can also have it in the zodiac signs, like you have it from Aries to Pisces. So these could also be there. And generally, people like to wear their own birth, kind of astrological sign, or they like to wear one which is very close to their heart, either their partners or any such things. And you have these diamond studs, again, which can be placed in the oral cavity. So is this jewelry for males or females? If that is your question, the answer is it is for both, like I told you. But generally, we don't place it for children. If it's a child, we generally place it only after the age of 16. I personally place it only after the age of 18. And if it is anywhere between 16 and 18, we definitely try to get the parental consent before we go ahead with such work. And how do you apply them? It is very simple. We have a dental adhesive, which we place it on the jewelry, and then we stick it out to your tooth. And this is as simple as how you would do a filling or a restoration. So does this application procedure hurt? If that is your question, the answer is no, because it's a very small drill which we place it on that area of the tooth. Sometimes we can do it even with a laser cut, and it is quite similar to placing an orthodontic bracket on the tooth. So it is hardly painful, and the procedure can be done any day, any time, and the patient can come in, get the procedure done, and walk out comfortably. And how long does this application procedure take? If that is your question, it generally takes around, say, 10 to 15 minutes. It's that quick, and it is very technique sensitive. So those 10 to 15 minutes, we try to see that there is no saliva or water contamination in the oral cavity. And once we are done, then the patient can eat, drink, and do anything they want. And the normal brushing techniques are taught, so it is nothing different than the general way of taking care of their teeth. And how long does this jewelry stay on your tooth? It generally, lasts as long as you want it to be there. There are basic instructions which we give to these patients. We tell them that, don't bite anything hard on that tooth because it might cause some abrasive wear. Or in case they are, a non-vegetarian, we try to tell them not to eat very hard stuffs or shearing force on those teeth, lest it would cause some damage to the jewelry. So like I told you, the different colors in the beginning, you can see them in multiple colors, and you must be thinking, oh my God, will anybody want to put something like that in the oral cavity? But my dear friends, things have changed, and people love to have these kind of glitz and jewelry sticking out from their teeth. And I'm not sure if you all know, if you read ancient dentistry, many kings and queens used to have these gems studded onto their teeth, and it was a sign or a mark of royalty. So with times this changed. There is also a kind of a belief that people like kings and queens used to get diamonds studded onto their teeth, and in case they were attacked by their opponents, and when they don't have any means of escapism, that they have lost the war, they feel it is better to die rather than to get into as a refugee, and hence sometimes they take these studded gems from their oral cavity, especially the diamonds, and swallow this because that could act as a danger. So in our cases, we don't put diamonds, we put zircon, and that itself shines like a diamond. It's less expensive than a diamond, but it shines and looks much better. And here you can see the various colors, and sometimes people love to put in a star and moon and all that stuff. It's just to give a kind of a glitz, a kind of a difference onto their teeth. So here, as I told you, there are lots of signs where they place it on their teeth along with the stones. And like you have jewelry for your ears or your nose, you can pierce your tooth also with these kind of jewelry. And it's beautiful to look at, especially when you're looking at it from the artistic point of view. So will this tooth jewelry harm my tooth? That could be the next question. So generally, as a dentist, we place it on the upper surface of the tooth, only on the enamel, and this does not cause any damage to the underlying tooth in any which way. And it is only an topical or the top kind of tooth part which is utilized in this kind of a work. And this should only be applied on natural teeth. Many people wear crowns and bridges in the anterior teeth or in the front teeth. So can tooth jewelry be placed on them? The answer is a no. So this can only be placed on natural teeth. And how do I remove the tooth jewelry? Like, see, many a times, like tattoo nowadays, many people place a tattoo, and after some years they don't want it, they want to remove it. So if you are one among them, you don't want that tooth jewelry after a certain point of time, or you want to change your tooth jewelry, change the color of the stone, or change the size or the shape, or add some glitz into that. So if you want to do that, it can be taken off very easily by the dentist with no damage to the underlying tooth. Now, how much does it cost? Definitely, the cost factor is a concern, but it does not cost, exorbitantly. That is why, as I told you, it has become a fashion fad right now. Prices vary. It depends on the design. It depends on the shape. It depends on the color of the stone. The usual color, which is white, is most preferred. It looks like a diamond dazzling, right? So you can ask your dentist for more information. Here you can see the stones. So that is how they will be available in different shapes and sizes. Here you can see them all in circular shape, but the sizes are different depending on the cost which the patient wants to afford, or the tooth on which it is to be placed. We select the size, but we generally leave it to the patient to select, because whatever they want, we try to adhere and give it to them. So this is how patients come to us. So what we do is we generally do a cleaning and a polishing, because we want the rest of the teeth to look nice. So if there is anything which is not looking nice, we try to clean it up before we go ahead with the procedure. So this is how your tooth looks after your cleaning and polishing. And now you can see in this particular patient, we have placed it on the mesial side of the canine. So the canine is the corner tooth of that patient, and you can see when the patient smiles, that is the tooth which is more prominently seen, and that is why it was placed there. And when you are having saliva in your oral cavity, you can see that stone literally glistening, and it looks very, very pretty. And many patients, after seeing, they want to get done. So you all become a brand ambassadors once you start wearing it and sharing it. So with that, we come to the end of today's session, and I'm super excited to listen to you all on the other side of this session. Before I end the session, I also want to tell you this is the first Crossing Boundaries I'm doing from my new venue, and I'm super excited to host you all here. And Happy New Year in advance, and hope the new year brings you a lot of good wishes and happy endings. So any questions? I'm open to it.
Very, very informative and excellent explanation. The whole thing is it is a brightening our face just by hearing this. Very good, very nice.
Thank you so much. Thank you so much, Raghuram sir, for joining us and interacting with us. It truly means a lot, because many a times when patients ask us, pre-COVID times, we were able to sit and answer a lot of questions patiently. But right now, sometimes the patients are a little concerned to stay for a longer period of time in the dental clinic. And that is why we started this Crossing Boundaries. And I'm glad through these sessions, we are able to answer a lot of queries, and you can rerun these videos on YouTube. Our channel is called Team Red Rockstars, Dr. Vidyaa Smile Dental Clinic. So you can always rerun all these videos and listen and understand. And again, if you have doubts, we are always there to answer. So thank you so much, sir. Okay, so with that, we come to the end of today's Crossing Boundaries, my dear friends. As always, it was a pleasure talking to you all, and wishing you all a very, very, very happy New Year 2022. Take care, stay blessed, and have a wonderful, fabulous New Year ahead. we'll definitely, wait to talk to you for crossing boundaries at the other side of this new year. Take care.